Denver 8 TV, your city, your source.
Let me thank everyone for being here today. This is a pretty monumental day in the life of Denver. Like every city in America, Denver faces challenges related to public health, including substance abuse and unmanaged and undermanaged mental health issues. Over the years, my administration has worked hard to address the issues that too often lead our residents to emergency rooms, jails, and homelessness. Most recently, we've talked about the enormous costs that the people of Denver are bearing as a result of our inability to, I think, effectively deal with this cycle. But we recognize that there remained an underlying issue or issues around behavioral health that weren't being adequately addressed. I'm here today to announce establishing the city's first Office of Behavioral Health Strategies, a groundbreaking effort to address those issues by analyzing our current situation and bringing the community together to coordinate strategies that lead to solutions. Through this collaborative effort, it is Denver's goal to improve the well-being of our community, supporting those who need our help the most. To lead this effort, I have tapped a familiar face, someone with a depth of experience not only in behavioral health, but also with the city government. I've asked Don Morris to lead the new Office of Behavioral Health Strategies to work to create a robust, effective strategy for the city and county of Denver to positively impact mental health and substance use issues within our community at large. Let me just share a brief anecdote with you before I share with you what we're going to do in this office. It wasn't very long ago that I had been dealing with a perplexing question within my own head in terms of how do we begin to really make greater inroads with the chronically homeless in our city. We have been effective in dealing with those who deal with episodic homelessness and effective in moving them to jobs and to housing and resetting their lives. But we had really struggled with, and we continue to struggle with, the chronically homeless. And as you drive through our streets, it's those individuals that are most visible in our community. And so one of the questions I asked is, maybe we've been going at this from the wrong angle. And so I called a friend up one day by the name of Jeannie Ritter. And I said, Jeannie, will you join me for lunch? And she did, and we were sitting over our salads one day. And I said to Jeannie, I said, I'm struggling with this, and part of the reason why I'm struggling is I think we may be missing the mark when it comes to mental health and substance abuse of the folks we're trying to impact. To which Jeannie dropped her fork and she looked at me with all seriousness and she said, finally, someone is asking the right question. And from that moment, it started a journey. And I asked her if she would pull together some of her friends in the industry or in the sector and help me to understand, help us all to understand what we can do more, do better and stronger on this issue. And she did. And this group of individuals from Mental Health of Colorado, Mental Health of Denver, Arapahoe House, and so many others came together. They took trips on their own to look at other issues and look at how other cities are doing and came back with a recommendation. And this is one of the recommendations that they brought. A body and office to begin to coordinate all the services and to help us to get stronger in the city. And this office will help us under Don's leadership. The Office of Behavioral Health Strategies will work to ensure collaboration and coordination among the city's current activities around behavioral health, increase training of key city personnel around mental health and substance use issues, raise mental health and substance use awareness within city government and in the community, and work with key partners such as Denver Public Schools, the business community, and other cities and counties in the metropolitan area, seeking innovative ways to address community behavioral health needs. Don, as we all know, is a native of Denver. He will start his new position on January the 5th. He brings extensive knowledge in healthcare, education, disability rights, employment and workforce development issues. And he also, as you know, is our former elected city auditor. And he knows this city inside out and how he can bring systems together to coordinate for the common good. So with that, it's my pleasure to introduce our new Executive Director of Behavioral Health Services in the City and County of Denver, and that is Don Morris.
Well, thank you all. Thank you. Gosh, thank you all very much. Certainly thanks to the mayor for this amazing opportunity, but I think what I'd really like to thank Mayor Hancock for is this incredibly bold, innovative strategy that our research shows may not have been done in any other city in this country before. So we're actually plowing new ground to really address this issue in a more comprehensive way. I think about this opportunity because having been in city government and state government so much, governments tend to be necessarily a very reactive kind of endeavor, particularly at the city level, and necessarily so. We, even though we're working on crime prevention, you better darn well, call 911 and get somebody to your door. It's kind of how the cities and state governments tend to operate. So this effort is actually an effort to try to break that down. In the behavioral health field, particularly in mental health and substance use, we have been for way too long a very reactive kind of system as well. In the Mental Health America National lingo, we talk about addressing this issue before stage 4. So just to use an analogy, if you were a woman with breast cancer and we treated her like we treat people with mental health issues, she'd be in the office with a lump and we'd tell her to go home and wait until it got serious. And then when it got, throughout her entire body, she'd come in the office and we'd finally decide it's time to do something about it. And then you know what we would do if we treated that like we treat mental health? We'd probably either throw her in jail for treatment or we'd let her be on the street for treatment. That's just unacceptable. And I think what I'm standing here, with this really visionary mayor saying, and what we're talking about when we create this office, is really addressing this issue before stage 4. Trying to really be proactive about the issue of behavioral health. I think it's key to start with a philosophy that mental health and substance use issues are everybody's issue. This isn't that person's issue, those people's issue. It's our issue as a community. And I think we need to work better to coordinate the efforts being done in the city. That's one of the first initiatives, is to look at what the city is doing presently. And if you type in mental health into the mayor's 2014 budget, you find at least a dozen places throughout the city where mental health is being addressed. That's very good. But it would be nice to have those efforts coordinated, to talk about how we can work off each other to improve those systems. We need to ponder the question, what more can a city do? Since the mayor has put this innovative strategy together, it really begs the question, so what more can a city do? One thing a city has to do is not do it alone. We work in partnership with Mental Health Center of Denver, Denver Health, work in partnership with Denver Public Schools, with our city and county governments that surround us and the state. That's the effort that we're putting on the table. So I guess I end this by saying, the Denver Post did what we thought was a marvelous series recently around this issue. But one of the questions that kept being asked around that was, what next? So what do we do about it? Well, this visionary mayor is doing something about it. I'm honored to be the first head of this new office. Certainly very challenging. But as far as I'm concerned, into music, and Alan Parsons' project has a neat song that says, something's in the air. And I think around behavioral health and mental health, there's something in the air. And I think this mayor gets it, and I'm just honored to be leading this office. Thank you very much, Mayor.
Thank you, Don. Congratulations. Just a quick moment. I was also honored to be able to participate in this conversation. We did get a running start at this, as the mayor said, and we have a lot of really wise folks in our community that work on this issue. And so getting those folks together, many of you are here in the room. Secondly, to have you right within arm's reach, Don, was really great. We didn't have to look very far for somebody who had just the right skill set to bring to this. And then, and I'm sure you've been called worse, but the rocket fuel behind this whole thing was you, Mayor Hancock. Really not letting this issue drop off when so many other things came to the forefront, and just kept a steady pace towards it. And so this is what we have. And as so many partners here in the room, Benny said, this is one of the first steps to really bring all of these efforts, really remarkable efforts going on in our community, bringing them together to really begin to meet the outcomes that we're looking towards. So congratulations, and congratulations to such a great community. Attaboy.
Thank you.
Hello, everybody. What I was saying before was just hello. My name is Evan Silverman, and I sit on the board of directors of Mental Health America of Colorado. I have also worked at the Tattercover bookstore here in Denver for over 17 years. Like so many people, I'm a Denverite who has lived experience with a mental health issue. I have experienced illness, recovery, and wellness throughout my life, and I continue to work to keep myself healthy. Part of my strategy for health is being connected with important causes and helping other people. I am here first and foremost as an advocate for mental health. I thank Mayor Hancock for his bold decision to create an Office of Behavioral Health Strategies for the City of Denver and choosing my friend, Don Morris, to lead this effort. Can people hear me? Good. Don Morris is the perfect person for this new position. His intelligence, creativity, and compassion will serve the people of Denver well, as they have been such a positive presence in my life. I have observed and worked closely with him as he spent 4 years as president and CEO of Mental Health America of Colorado. Like me, Don is passionate about helping others. He inspires those he works with to achieve their potential, partly because he knows they know he truly cares about building a better future. Part of the reason I'm able to be here today is positive choices I have made when dealing with an illness. I have not done that alone. I've had a tremendous amount of support that many people never receive. I look forward to working with the mayor and Don to help more people have the opportunity for better mental health. This cause has the potential to save and improve the lives of countless individuals and their families. Thank you again, Mayor Hancock, and congratulations, Don.
Thank you all. And again, let me just thank everyone here today. I'm looking in this room and I see Benny Milliner from Denver's Road Home, Reggie Herder from the Crime Prevention and Control Commission. How come I always step on that? Crime Prevention and Control Commission. I see Doug Linkhart, who was part of creating the Crime Prevention Control Commission, because we understand that this issue of mental health and substance abuse goes so deep in our society. It impacts what our sheriffs are dealing with in the detention center. It impacts what we're dealing with in trying to move people from the streets to more sustainable living. It impacts what Denver Health is dealing with on a nightly basis with our frequent flyers, what our court system is seeing, our children being impacted by parents who have unmanaged, undermanaged mental health challenges, what our school system is dealing with, children who are misdiagnosed and misunderstood because they're untreated. This is a serious issue in America, and I do want to thank the Denver Post. I know this is groundbreaking. I'm thanking the Denver Post. But I want to thank the Denver Post because I thought their series was groundbreaking, and it was eye-opening, and it was reassuring because we were already in this journey, and it was timely. And so I'm grateful to the Denver Post for the tremendous work and the wonderful reporting that it did on this issue. To all of the stakeholders who are here, thank you for what you do every day to deal with those who live in the shadows of our community and who are reaching out, seeking help that impacts their lives and lives of so many. Thank you all. Let me ask if there are any questions. Yes?
Mayor, what are the major efforts the city has underway on mental health and various agencies that Don will be helping to coordinate?
I think what you'll see, and Don mentioned it, and I saw it in the budget this year as well, that there are a lot of different efforts underway in Doug Linkhart's shop in environmental health, in Denver Health, and their major operations. In our Denver Human Services, under the leadership of Penny May, there are tremendous in our Children's Affairs Office and Crime Prevention and Control Commission, Denver's Road Home. There is a myriad of services that are being provided here in the city of Denver. Don's job will be similar to what Ashley Kilroy is doing under the Marijuana Policy Office, and that is to coordinate all these services and to move with a more collaborative and concerted voice on the issue. We are so far behind as a society in addressing this issue. We want Denver to lead the way, show how cities can play a role in doing better coordination.
Yeah, let me comment, and the mayor did a good job inventorying. I also want to comment that if you think about where a lot of our services are today, they tend to be in the homeless corrections sort of area and human service area. I will repeat this a lot while I have this position. This is everybody's issue, and one of the challenges and opportunities is not only to help those operations work more efficiently and better, but also to look at what else we can do for a community in the mental health space and the behavioral health space that impacts all of us. So it's to ask questions about what else could we do. While I've got the mic, I would love to introduce, first and most importantly, my wonderful wife, Ruth, who always supports me in this. Appreciate it, Ruth. I saw you back there, and my son, DJ, who's here. Thank you both. Appreciate it. And I am, you know, this was certainly a difficult decision because I have such a great organization, and my current board chair, Marty Waters, and incoming board chair, Chuck Ryman, are here. Very much appreciate your support through all this and through the last 4 years. But anyway, thank you very much. That's a good question.
And Don, what kind of, will you have any staff behind you, or what will be the scope of this office as far as just that type of thing?
Yeah, at the outset, I'm going to be working very closely with Reggie Herder, who has been a wonderful partner of mine as I've worked on the state's Behavioral Health Transformation Council. So Reggie and I have worked well together for several years. So I'll be working with Reggie and then identifying those opportunities where we can have some efficiencies and make some difference, and then decide what kind of staff this office should have. And, you know, a part of it is some of this may not need more staff. All it needs is better coordination. But we'll decide that as we do the kind of scan of the environment of the city.
Do you have a sense of whether other cities have done anything like this? How groundbreaking is this approach?
Well, it's our understanding, and I appreciate Dr. Clark's research and his organization around this, that no city has done this kind of effort, no major city. It's our understanding, which makes it a huge opportunity. Clearly a daunting task, but in my opinion, a huge opportunity. So, you know, we hear, I heard New York, for example, on Monday announced some kind of effort around behavioral health in the jails, in the population of folks in their jails. You hear those kind of initiatives, but this kind of groundbreaking connecting dots beyond homeless issues that they face around mental health and substance use and jails, we don't understand has ever been done.
And what do you see as your biggest challenges?
Well, it's not, I suppose, very different than what I've faced even at Mental Health America, where what you're trying to do is connect people to work together toward a strategy. And as you broaden the conversation beyond something that's definable, like people in the correction system, it then gets challenging to get people, you know, at the table working together and then come up with a strategy everybody can, you know, be on board with. Clearly that is a challenge. I would say the ultimate challenge around this whole conversation tends to be stigma. And I have a hunch that, you know, whatever conversations we have as we broaden it, we will face the question of stigma. And I think we need to always be thinking about how we civilize the conversation around mental health and substance use.
Mayor, have you sorted out funding for this? How much funding is
Well, I think, yeah, we're already beginning the process of pulling the various resources together. I think, again, one of the things that I want you to understand is that we've identified places within the budget that we already are spending an enormous amount of resources on mental health, but not really speaking to one another. I think what you're going to find is by doing a more coordinated approach, a more comprehensive approach where everyone's in tune and everyone's on the same page, we should ultimately be able to be more efficient and more resource prudent with regards to how we allocate our dollars. So that's going to be Don's job. Let's get them to work, and then we'll identify really what are the real resources available to hit this going forward.
What's the budget next year for this office?
I don't know that off the top of my head. We'll get that to you. We'll make sure we get it to you. Yes?
Talk about some of the specific outcomes you're looking for, which we hold you to in a year
Well, first of all, I think that if we should be making progress, and Don can talk to this as well, but progress in coordinating services. I cannot underscore how important that word coordination is, because we're all over the place right now, and we got to get smarter. We got to think better, stronger, and faster with regards to our address of behavioral health services. And then two, how it impacts things such as our jail population, any movement in regards to how we treat those who come in with mental health challenges, as well as our Denver's Road Home effort.
Good question. And, you know, as you're embarking on something as innovative and new as this, that kind of thing takes a little time to define. But let me tell you, one thing that's a little different than when I was with the city as the city auditor is that the city now has an office within the administration that looks at, you know, outcomes and making sure that what efforts are taken on actually have measurable outcomes. So, you know, I now understand that, and I think that's been a vital part of the city's operation. And we'll be working with that office to be sure that when we talk about, you know, wanting to have the city workforce be more engaged in this, my heavens, you have an army of people out there who can be ambassadors and helpful in this conversation. Then we will try to define, okay, what measurable standard are we putting on the table that we can in a year say we've achieved success. This is big stuff, so it might not be 1 year, it might be a 3 to 5 year goal, but nonetheless, it's certainly been communicated to me from the very highest levels of government that we do need to establish standards around our outcomes.